Good morning, you're tuned into daily coronavirus updates. Today is the 18th of June and you're watching The Wire. In the last 24 hours, 13,055 more people have contracted the virus. This is the highest single-day spike in the number of cases recorded in India so far. With this, over 3,67,000 people have been infected by the virus. The number of fatalities has crossed the 12,000 mark. Aam Aadmi Party's MLA and national spokesperson Atishi has tested positive for COVID-19. Chief Minister Arvind Kejriwal took to Twitter to wish her speedy recovery. Delhi's Health Minister Satyendra Jain, who was tested for COVID-19 again today, has also tested positive. Globally, over 4 lakh have lost their lives and over 39 lakh people have recovered. The United States remains the worst hit country. It has over 21 lakh infections so far with over 1 lakh deaths. Meanwhile, Beijing officials reported 31 new confirmed infections in the region. Prime Minister Modi held an interaction with chief ministers yesterday as a part of his consultations with state governments on ways to check the spread of the virus. The Prime Minister said that more than 1 crore PPE kits and an equal number of N95 masks have reached the states. This reportedly came after Maharashtra, the state which is witnessing the worst coronavirus outbreak, demanded from the centre COVID-19 treatment drugs. Maharashtra demanded remdesivir and tocilizumab in large quantities and at reasonable rates. Maharashtra also demanded an additional 500 ventilators. India also received the first tranche of 100 ventilators from the United States on Tuesday. In a series of tweets, the Ministry of Home Affairs last evening said that after receiving a report from a high-level expert committee on COVID-19, it has been decided that COVID-19 testing rates in Delhi would be reduced to 2,400 rupees. Earlier, the price of tests in government and private laboratories was around 4,500 rupees. In another tweet, the Ministry of Home Affairs noted that from 18 June onwards, tests in Delhi will be done via the new rapid antigen methodology approved by the ICMR. This is a faster method to test and Delhi would be given priority for these kits, Ministry of Home Affairs said. A cheap and widely used steroid called Dexamethasone has become the first drug shown to be able to save lives of COVID-19 patients. Scientists have called this a major breakthrough in the coronavirus pandemic. Trial results announced on Tuesday showed that dexamethasone, which is used to reduce inflammation in other diseases such as arthritis, reduced death rates by around a third among most severely ill COVID-19 patients. The preliminary results suggest that the drug should immediately become the standard care in patients with severe cases of the disease. The results of the study are yet to be formally published. The World Health Organization hailed the news of this drug as great news. WHO's Dr. Tedros said, "This is the first treatment to be shown to reduce mortality in patients with COVID-19 requiring oxygen or ventilator support." As part of the randomized trial, over 2,000 patients enrolled were administered with 6 mg of the drug for 10 days. Researchers found that the drug reduced death by 1/3 in ventilated patients and by 1/5 in patients receiving only oxygen. The WHO has also said that it was moving to update its COVID-19 guidelines on treating people to reflect results of the clinical trial. Earlier this week, PTI reported that a group of scientists, some of them affiliated with the ICMR, released a study which said that India's COVID-19 epidemic would peak around November 2020. However, on the 15th of June, ICMR issued a tweet distancing itself from the study as well as disputing its method. The Hindu quoted Rajnikant Srivastav, who is the head of research management at ICMR, saying that news reports attributing the study to ICMR are misleading. Journalist Sumi Sukanya Datta subsequently questioned the organization on Twitter about one author being an ICMR scientist and another being a senior member of the National COVID-19 Task Force. To this, the ICMR then replied, "The manuscript has been written by an author who is not an employee of ICMR. When questioned, the first author accepted the mistake and withdrew the paper. Since there was no direct involvement of ICMR in developing this manuscript, issue of convenient withdrawal does not arise." But doubts continue to persist over ICMR's involvement. Anant Bhan, who works on issues of bioethics, global health and policy at Kasturba Medical College in Manipal, tweeted that if ICMR say they did not fund the study and authors claim that it was funded by ICMR, then this is a gross publication ethics issue. Some scientists and health journalists have demanded that the organization issue a full clarification instead of a point-wise replies on Twitter. In an interview to The Wire's Karan Thapar, Raman and Lakshmi Narayanan, who is the director of the Washington-based Center for Disease Dynamics, Economy and Policy, has said that India probably already has tens of millions of COVID-19 infected people. He said that ICMR's recent serological survey, which suggested that 0.73% of the population has been exposed to the virus, confirms his claim.
You have great expertise in disease modeling and in epidemiology. What do you think will be the situation facing India 3 months from now, say in September?
When we last met, I had said there would be about 300 million infections by July, and that was before any discussion of a lockdown. The lockdown has probably pushed that date out a couple of months for the period of the lockdown. So we're now expecting that maybe 2 months later. ICMR's survey, which I know you want to talk more about, indicates that there were 10 million infections back in late April or early May. We don't have the exact dates, but somewhere in that time there were 10 million infections. So remember, we've gone from what my guess would be about 10,000 infections in mid-March. 6 weeks later, we go to 10 million infections in early May, and we're now 6 weeks past that point. It is not inconceivable that we are already in, the tens of millions, if not at the 100 million infection mark. So
I'm asking you to pause that. It's not inconceivable that already as of today,
yes,
we are at the 10 of millions of infections.
It is possible. We won't know unless we do these serology surveys.
But it's quite logically possible that as of today, we've reached tens of millions of infections.
Keep in mind that it's a jump of 1,000 to get from 10,000 infections to 10 million infections. To get from 10 million infections to 100 million infections is only a jump of 10.
When will we get to the 100 millions?
I think that in the next 2 months, probably, if not end of July, then probably by the end of September for sure, we will be in the hundreds of millions.
A report collated by Delhi-based rights and risk analysis group noted that as many as 55 journalists were arrested, booked, threatened for reporting on COVID-19. In a press note, the group said that the highest number of attacks on media personnel during the period was reported from Uttar Pradesh, followed by Jammu and Kashmir. The report said that as many as 22 FIRs were filed against various journalists during the period, while at least 10 were arrested. It said that 4 journalists were saved from being arrested by the Supreme Court for performing their duties during the period. According to the report, at least 9 journalists were subjected to beating, including 2 in police custody, while 1 journalist was held hostage by the Sarpanch of a village in Orissa. In Telangana, a house of another journalist was allegedly demolished because of a COVID-19 related report he had filed which involved the ruling party MLA. A woman journalist in Arunachal Pradesh was threatened for publishing a story on a wildlife hunting spike during the lockdown. You can read the full report on thewire.in. The United States Food and Drug Administration earlier this week revoked its emergency use authorization for 2 malarial drugs, hydroxychloroquine and chloroquine. These drugs were touted by President Donald Trump as a treatment for coronavirus. The US FDA has now said that these drugs are unlikely to be effective. Citing reports of heart complications, the FDA said that decades-old drugs' unproven benefits do not outweigh the known and potential risks. China's capital witnessed a slight increase in new coronavirus cases yesterday. Beijing has introduced a wave of new infections followed by restrictions which include cancelling over 60 commercial flights in and out of the city. Beijing's Education Commission also ordered the closure of all schools to stop the new surge. New Zealand Prime Minister Jacinda Ardern has assigned a top military leader to oversee the country's border quarantine measures after what she described as an unacceptable failure by health officials in allowing 2 women who returned from London to leave quarantine before they had been tested for the virus. These two women tested positive in New Zealand. Before this, the country was declared as coronavirus free after not reporting any case for more than 3 weeks. Thank you for tuning in. Keep reading and watching The Wire and The Wire Science. We will see you tomorrow with more updates. Until then, stay safe.